Hi everyone, and welcome back to day 2 of our C Arthritis event here at the ABN booth at CRA and AHPA Annual Scientific Meeting in Victoria. I am so happy to start the day off today with Dr. Paul Fortin, and he is actually the recipient of this year's Distinguished Investigators Award. Thank you so much for joining us today.
It's my pleasure. Thank you for inviting me.
Of course. So would you mind starting off by telling us a bit about yourself and how you're involved in rheumatology?
Yes, so I'm a rheumatologist. I do see patients, but I also do research. My interest in rheumatology actually stems back to when I was a medical student, and I was fascinated by patients that had chronic disease. It could be sometimes challenging, you would think, but I was impressed by the adaptability, the resilience, and the courage of these young women in particular. And I also had a senior resident who was really good at teaching, and it was an open book for me to learn about the immune system and how inflammation can trigger arthritis attacks. So that was the beginning. And then I realized I really liked interpersonal relationships and biology. So rheumatology was the perfect fit for me, because in rheumatology we really have to know the person and we follow people over time, because these are chronic diseases. So for me that was a logical choice.
Right, absolutely. So, can you tell us about, on Friday, you'll be giving a keynote address on a topic of the power of money in lupus research.
Yes. Well, I've been quite privileged first to have worked with many people and many collaborators, many patients, many allied health professionals over my career, and I don't think I wouldn't be here for those if it wasn't for those people. So when I had to give that keynote lecture, I said, what has been really instrumental for me to be able to do research is to be able to work with many centers and many people across the country. When I train as a researcher, one of the things I learned is if you ask a question and you will involve people, arthritis patients, into a research project, you have to make sure that you will be able to give an answer back at the end of your research project. In lupus is one of the fields of interest I have, and it's a relatively rare or infrequent disease. So if you work only in a single center, you usually don't have the number of people to be able to get an answer to your research question. So it has been very important for me to be able to meet that challenge of having the answer back, and for that we needed to have a lot of patience. So we've started very early in the 1990s when I came back from my fellowship in Boston to create collaborations. And it has grown, and up till today we now have an organization, for example, in Canada called the Canadian Network for Improved Outcome in SLE. Many academic centers across the country are contributing, and this is how we've been able to do quite a bit of research projects. So in my talk I'm going to kind of summarize a little bit that history and hopefully highlight some of the good things we've done.
Right, perfect. And so when you talk about collaboration between these groups, does that involve interdisciplinary collaboration as well? Absolutely.
So I've been working forever with nurses, with one of our co-investigators, and many of our projects has been a psychologist, a health psychologist, Debbie DaCosta at McGill University. And we've also had one project where we involved, we had to look at exercise and how you try to help people make the right choice. So we need to also have the input of exercise physiologists. So you can imagine that it's a very broad area when you start to look at the behaviors and how you could help people make the right choices about their disease and their treatments.
Yeah, absolutely. And so what are some of the challenges in this collaborative research approach?
Well, the power of money is also sometimes the challenge of money. So you do have, there's some that are very pragmatic. First, it is difficult to conduct a research project over several sites over a large country like Canada. So communication is a problem, and also making sure that everyone feels they're entitled to the recognition they deserve in contributing to research. And also there is always underfunding for the type of research we do. So a lot of people have contributed with their own time, which I want to acknowledge and recognize, but this is a challenge as well in people life are pretty busy. They're clinical rheumatologists, and they, on top of that, contribute by recruiting patients and sometimes filling in forms and making sure things are done the appropriate way. So many challenges there.
Of course, and I guess that especially if there is underfunding is a reality that makes collaboration all that more important, so that sort of the funding is going towards a collaborative project where many are involved.
Yeah, I have to say that we are privileged in Canada because many people have been willing to donate their time, and funding it's a key issue, but it's not the determining point.
Right.
You know, it still allows you to go ahead, and we've been fortunate also to have funding from peer review agencies, the Arthritis Society, the Canadian Institute of Health Research, so that has helped Lupus Canada as well.
Right, wonderful. And so I know that another research interest of yours is the psychosocial impact on rheumatic diseases.
Yeah, that has been an early choice of mine, is where could I make most of a difference? I do not have a wet lab, right? So I don't look at cells or how cells talk to each other. I'm more interested in how will we make sure that someone who has arthritis or lupus, how will they maximize their life and make sure that they have a good quality of life? So I have already, when I started my research career as an early researcher, labeled my program as improving the function and quality of life of patients with lupus. And it gives you an interesting perspective because we've made so many good progress in terms of drug in arthritis. In lupus, we're hoping to get there. It's a little bit longer to get to the right drugs, but there's been quite a bit of progress and a lot of investment is being done in the drug development. But I'm also interested in this aspect, the quality of life, how people can achieve, maintain their work and their function, how can they have access to exercise, how they can have a better sleep and no pain. These are more difficult concepts and also to get the right resources to the people. It's more difficult to have funding for that type of research.
Right.
So that has been one of my interests in how to really address this underlying issue of quality of life. If you look at lupus patients, usually on average our patients will be around 40 or 50. They will have had 10 years of disease. If you measure their quality of life, they're scoring really low in physical function.
Right.
These are women that looks perfectly healthy on the outside. Still, they're very handicapped by their condition, and we can improve that. And we have to improve that. This is our obligation, but not necessarily through only using the good drugs, because some of these women have very good control of what we think is their active disease, yet they're still very fatigued, they still have problems. So that has been a bit the underlying motivation for some of the research I'm doing to improve that aspect.
Yeah, and so I'd be interested to know your findings from that research about what are ways to improve then that psychosocial experience.
Right. Well, the first thing we have to realize is, although we do say there are challenges in lupus, there are very good treatments already and very good approaches. So we always have to go back to lupus 101 and what is the best thing to do. So lifestyle improvements. We used to think that when we had arthritis, we needed to rest the joint, to be very careful. We almost caused fear to our patients to move around. And we've discovered we really have to encourage to keep moving.
Right.
Keep doing exercise to the extent of what you are able to do. Sometimes you may need a coach to reassure you to get back to that, but exercising is important. Healthy lifestyles, we know that smoking is probably not good in any inflammatory condition, so all of that should be reviewed and discussed with a patient that has arthritis or lupus. Then we do have drugs that we are using for more than 40 years, and so adherence to a good drug plan I think is important already. And this is quite immediately available. I believe that adherence will be better if the patient accepts and participates in the treatment plan.
Right.
So that is part of the research I've been doing, especially with Dr. Debbie DaCosta, trying to find how do you activate people to really believe they can be in control of their treatments. So you see, it's a dimension above. We do have drugs available, and treatment is beyond just taking your pill. It's how you change your lifestyle, how you accept to live with this condition. Someone yesterday mentioned live the fullest with arthritis. I think this is really a very good quote.
Yeah, absolutely. How do you hope to see psychosocial issues to be addressed in the future moving forward?
Well, I think there's already been some interesting improvement. Yes, the day before yesterday, it's already been 2 days in here. There's a research conference at this conference that's new this year. There was a whole afternoon session on pain and the importance of pain in a lot of our patients. And for example, there is now interest in trying to understand not only the biology of pain, because there is biology of pain, but also the psychosocial aspects of pain. And so if we are seeing more funding to be able to understand these issues, we'll be able to bring it back to our patients and try to apply those. I think the same is true with sleep, fatigue, depression, or mood disorder. And all of these can really impact the quality of life of our patients, and we have to have more possibilities to study them so we can bring solutions.
Absolutely. And I was wondering, as you just mentioned sort of depression and these things, would you say that people with rheumatic diseases are more likely to experience mental health conditions?
Yeah, we know, unfortunately, and it's been intriguing because if you don't talk about arthritis, but you talk about the field of mental health, there has been now suggestion that maybe inflammation is involved. So if we have on top of it an inflammatory condition, it pleases the mind that maybe there is an increased risk for mental health conditions. Fatigue is one issue also that will bring your mood down. So they're all interrelated. Poor sleep will also make it worse. And if you don't exercise, it goes into this vicious circle. There is data that there is more diagnosis of depression in inflammatory disorders. So yes, absolutely.
Right, that's very interesting. Thank you. So I guess what I would like to ask now is, as a practicing rheumatologist and as in the research you have done, what advice would you have for patients?
Well, again, one of the things that I tell my patients after a few visits, not on the first visit, but that once we have for sure a diagnosis that is confirmed and solid, is well, you've just made a friend for life. Your rheumatologist is usually a friend for life, but we need to go beyond that, and we need to think of a care system. So I think patients that will do well will have a good network with a lot of possibilities for accessing resources.
Right.
So we need to we try to work on what is the person's network. And one of the things that immediately I start using is a comparison that has been useful for me is the Windows comparison.
Okay.
If you have a computer with Windows, when you're diagnosed with a new condition like lupus, it takes the whole screen of your computer, and you cannot see beyond that, and it's very distressing initially. Normally it is. If we are able to make the person better and confident that they will get better, that windows can be narrowed down a little bit, and you can start seeing behind your life that you had before, the life that you will have. And my goal is to bring, and I tell them, to bring the little window, like a little icon at the bottom of the screen. You live your life, you do have this condition, it's chronic, you cannot ignore it. Sometimes a window will pop up a little bigger, and we're here to help you.
So, I like that. It's still there. It's always there, but it can be minimized.
Right. Exactly.
Wow, I really like that metaphor. So, Anita, do we have any questions from the audience?
You mentioned that communications is very important between patients and healthcare professionals. What can patients do to ensure their concerns are being heard?
Well, a few things. People can prepare for their visits with their healthcare professional, being a rheumatologist or a nurse that is part of the care team or physiotherapist. So there are sometimes tools you can go and see on Lupus Canada, or even we do have online My Lupus Guide, where there will be sheets you can prepare for that. And I think you need to make sure up front you're controlling part of the interview with the healthcare professional. Obviously, the healthcare professional will have important information to give you, so you have to have a dynamic that allows you to discuss what's important to you. So I think it's important at the beginning. I always say to my patients, what questions will you have? And we'll make sure to address them, but let me first tell you what I need to tell you.
And I'd be interested, as a patient, and I'm sure it is the experience of other patients, sometimes you feel that maybe these non-biomedical things, you're not sure if you can bring them up with your rheumatologist.
I always like to know.
Right.
Because people will sometimes be hesitant to tell you, I've tried this new diet or this complementary medicine. And I think it's much better we have an open, healthy discussion about everything that may be intriguing to you or you're not sure. Because there are things that we should know that maybe are contraindicated even in complementary medicine. But I think most of the time they can be harmonized with what your approach is to treat your lupus. Yeah.
Right. Great. Well, thank you so much for coming in
It's been
today.
my pleasure. Thank you for inviting me.
And we just want to let everyone know that we will be doing a follow-up interview right after this in French. So stay tuned.